Assalamualaikum and good afternoon. Today I'm going to deliver one lecture topic regarding the histology of the heart and also the blood vessel. So there are two component topic of this lecture, the histology of the heart and also the blood vessel. So these are the outline. This is the outline of my lecture. I'm going to discuss on the histology of the heart, the arteries. Okay, the arteries here include the large or elastic arteries, medium or muscular arteries, small arteries and arteriole, capillaries, arteriovenous anastomosis, veins that include small vein or venous, postcapillary and muscular venous, medium vein and also the large vein. So these are the components of my lecture. I hope you will enjoy to learn this topic. Okay, going to start to discuss on the first component of this lecture is regarding the heart. Okay. Okay. This is just the introduction part of the heart. The wall of the heart contain the cardiac muscle. Okay, definitely. The major component of the heart is actually the cardiac muscle. That's why the heart is actually the function is to pump the blood, because due to its component, where most of its component is actually consists of the cardiac muscle. And then it also has a fibrous skeleton, which there are 4 fibrous rings. These 4 fibrous rings it surround the valve orifices. Okay. And what is the function of these 4 fibrous rings? It provides the attachment site for the leaflet of all 4 valves. Okay. And this 4 fibrous ring actually is made up of dense irregular connective tissue. Okay. So we have 4 fibrous rings that surround the valve orifice. Okay, and this ring, this fibrous ring is very important. Okay, because there are 4 valves that been attached to the 4 fibrous ring. Okay, and then the other component of fibrous skeleton is fibrous trigon. Okay, and we have the left fibrous trigon and right fibrous trigon. Okay, the left one connecting the fibrous ring of the aorta and also the mitral valve. Okay, and on the right fibrous part, right fibrous trigon, it connects the fibrous ring of the aorta to the mitral valve and also to the tricuspid valve. Okay. Okay. Membrane is part of the interventricular and interarterial septum. Okay, which actually is part of the fibrous skeleton. And this membrane is part of the interventricular and interarterial septum. It is composed of the dense connective tissue. It is made up of dense connective tissue. Okay, we have the cardiac muscle, the first component, fibrous skeleton, and the third component is impulse conducting system. Okay, this is the third component of the heart. Okay, what is the function of the impulse conducting system? It is important for the initiations. Okay, initiate, start, and propagations. Okay, conducting. Okay, propagation of the electrical impulse for the cardiac muscle to contract. Okay, this impulse conducting system is like the electrical system of the heart. Okay. The impulse conducting system, it is formed by the highly specialized cardiac muscle cell. Okay, now we're going to proceed to discuss on the histology of the heart. Okay, now right now we are going to focus on the wall of the heart first. Okay, the wall of the heart, it has 3 layers: the epicardium, the myocardium, and also the endocardium. Okay, this is the wall of the heart. It has 3 layers. The epicardium is equal to the visceral layer of the serous pericardium. Actually, it's similar or equal to the visceral layer of the serous pericardium. The epicardium, it contains a layer of mesothelial cells, underlying connective tissue, the blood vessels, and also nerve, and the adipose tissue. So these are the content of the epicardium. Okay. For the myocardium, okay, this is the myocardium is the thickest layer. Okay, it is composed of the cardiac muscle cells, loose connective tissue. Okay, it's mainly composed of cardiac muscle, and it also composed of the loose connective tissue, the reticular and elastic fiber that fill space between the muscle fiber. So in between the cardiac muscle, we have the loose connective tissue and also the reticular and elastic fiber. And the myocardium, it has rich capillary network lah, because we need to have a good blood supply that that way it allow the blood to be supplied to the myocardium, because the heart need to contract very fast, right? I mean, it need to contract continuously. Okay, and then so it need to have a good blood supply. Otherwise, uh, it cannot function well. Okay, so myocardium need to have a good blood supply. Okay, because it need to have a continuous contraction, continuous contraction. So you need to have the good capillary network or rich capillary network. Okay, so this is the content of the myocardium. And the myocardium is thicker in the ventricle than the atria. Okay, the ventricle, the myocardium is thicker compared to the atrium. Why? Because you know that the ventricle, okay, here the pressure is greater. That's why, because it need to pump the blood throughout the body. So that's why the thickness of the myocardium in the ventricle is greater compared to the atrium. And the other thing that you have to know is cardiac muscle cell is striated. Okay, it's branch. Okay, striated branch, and the nucleus is centrally located, and it has a intercalated disc. The intercalated disc. So these are the characteristic of the cardiac muscle cell that you have to know. I think you have learned during your first block, right? Okay, I have still remember that part. Okay, and the third layer of the heart is the wall of the heart is the endocardium. Okay, the endocardium is thicker in the atrium. Okay, it is thicker in the atrium, and the endocardium, it consists of the different layer. Okay, we have the three layers. Okay, if you see here, okay, the inner layer that lined by the endothelium. Okay, the inner layer is lined by the endothelium. Okay, endothelium is a squamous type of cell, right? Okay, and then beneath the endothelium we have the subendothelial connective tissue. Okay, and then and then proceed with the second layer, the middle layer. Okay, middle layer of connective tissue that contain the elastic fiber and also the smooth muscle cells. These are the middle layer, the second layer. And the deeper layer of connective tissue, the subendocardial layer. Okay, is equal to the subendocardial layer. And this deeper layer, it continues with the connective tissue of the myocardium. Okay, the impulse connecting system is located in the subendocardial layer of the endocardium. So you have to remember that location of the where you can find the impulse connecting system is located at the subendocardial layer, the deepest layer of the connective tissue. Okay, deepest layer of the endocardium. Okay, you can see here. Okay, this is the heart. Okay, so you can see how we transect or we cut the heart lah. Okay, you can see here we have the epicardium layer. We have the myocardium. This is the largest layer. Okay, and then we have the very thin layer, the endocardium. Later we will show you the endocardium. Okay, the epicardium, the myocardium, okay, the myocardium, and the endocardium. Later I will show you. Okay, okay, this is the layer of the epicardium. Okay, you can see here, A is the adipose tissue. Okay, so M here is what? If you go back to the first slide that I have shown you just now, the epicardium, right? A layer of mesothelial cells. So here we have a single layer of the mesothelial cells. Okay, okay. You can see here, this is the bigger picture that show you the mesothelial layer of the single layer of mesothelial cell. Okay, so these are the epicardium layer. Okay, from here to here, from here to here, the epicardium layer. Okay, and then the endocardium. Okay, so this is the endocardium. Okay, you can see here we have the endocardial layer. Okay, so you can see here we have the Purkinje fiber. So if you see here, this is the Purkinje fiber. Okay, okay. Now we're going to discuss on the interventricular septum. Okay, this is the, sorry, I'll go back to the early part of the picture. Okay, I forgot to mention to show you this part. Okay, you can see here, this is the endothelial layer. Okay, okay, and then when we enlarge the magnification of the picture, you can see like this. Okay, like this. Okay, you can see here we have the endocardium. We have the endothelial layer. Endothelial layer. Okay, this is the myocardial layer. Myocardial fiber. Okay, myocardium. Okay, myocardium. You can see here. Okay, myocardium. The cardiac cell. Cardiac cell. Okay, myocardium. Okay, okay. And then for the interventricular septum, interventricular septum, it contains the cardiac muscles except in the membranous portion. Okay, so you have to remember, contain cardiac muscle except in the membranous portion. Okay, and then the endocardium line each surface of the septum. Okay, so each surface of the septum, it is lined by the endocardium. Okay, that one is the interventricular septum. How about the interarterial septum? It has a central layer of cardiac muscles, okay, except in the certain localized area where there is a fibrous tissue. Okay, so the central layer is cardiac muscle, except certain area lah. Okay, and then the endocardium line each surface of the septum. Okay, for the heart valve, they are essentially fall of the endocardium. Okay, heart valve actually is made up of the fall of the endocardium. Okay, whenever the endocardium is fall, so it forms the heart valve. Okay, the valve curves are normally avascular. Okay, valve curves, okay, valve deflate, valve curves, it does not have a vessel, avascular. The surface are thin. Okay, the surface of the valve is very thin, so it allows nutrient and oxygen to diffuse from the blood directly lah, because of the surface of the thin. Because just now I mentioned that the heart valve is does not have a vessel, avascular. And then the small blood vessels and smooth muscle can be found only in the base of the curves. Okay, small blood vessels and the smooth muscle can only be found in the base of the curves, because usually the base of the curves is usually more thicker compared to the remaining part. So sometimes you can find the small blood vessels. Okay. The heart valve is composed of three layers: the fibrosa layer, spongiosa layer, and also the ventricularis. Okay, so these are the three layers of the heart valve: fibrosa, spongiosa, and ventricularis. Okay, for the fibrosa, it forms the core of the valve. Let me show you. Okay, so you can see here, this is the fibrosa. Okay, it forms the core of the valve. Okay, this is the example of the mitral valve. Okay, core of the valve. It contains fibrous extensions from the dense irregular connective tissue of the skeletal ring of the heart. Okay, actually, fibrosa layer is a extension from the dense connective tissue, irregular connective tissue of the skeletal ring of the heart. Okay, and then for the spongiosa, okay, spongiosa. This is a spongiosa. Okay, this part is facing toward the atrium. This part is facing toward the ventricular. So you can see here, this is the spongiosa. Okay, spongiosa is located on the atrial, on atria and the blood vessel side of each valve. Okay, you can see, because it's facing toward the atria, right? Okay, or facing toward the blood vessel side of each valve. And spongiosa is covered with the endothelium. Okay, it contains the loose connective tissue, okay, covered by the endothelium. Okay, and contain loose connective tissue composed of loosely arranged collagen and elastic fiber infiltrated with a large amount of the protoglycan. So the function of the spongiosa is to act as a shock absorber, okay, because it's direct contact with the blood. And spongiosa also confer flexibility and plasticity to the valve curves. Okay. In the aortic and pulmonary valve, okay, spongiosa located on the blood vessel site is called the arterialis. Okay, in the aortic and pulmonary valve, spongiosa located on the blood vessel site is called the arterialis. In the atrioventricular valve, AV valve, okay, spongiosa located in the atrial site is called auricularis. Okay, so we have a specific name for spongy cell based on the location of the valve. Means based on the location of the valve. Okay. Okay. And then for the ventricularis layer, so you can see here, this is the ventricularis. Okay, ventricularis. Ventricularis is immediately adjacent to the ventricular. Okay, press into the ventricle. Okay, and or the end or arterial surface of each valve. Okay, okay, immediately adjacent to the ventricular end or arterial surface of each valve. Okay, the ventricularis layer, it is covered with the endothelium. Okay, and it contains the dense connective tissue with many layers of elastic fiber. Okay, in the atrioventricular valve, okay, AV valve, it continues into the chorda tendineae. Okay, the ventricularis layer, it continues with the into the chorda tendineae. So what is the chorda tendineae? I hope you still remember what is the chorda tendineae. Maybe someone has issue regarding cross anatomy of the heart. Okay, so the chorda tendineae is a fibrous and thread-like cord covered with the endothelium. Okay, thread-like cord. Okay, fibrous. It is composed of fibrous component. And the chorda tendineae, it extends from the free edge of the atrioventricular valve to the muscular projections from the wall of ventricle called the papillary muscle. Okay, I hope you know the what is the papillary muscle. Okay, so that is the chorda tendineae. So it extends from the free edge of the AV valve to the muscular, be attached to the muscular projection. Okay, and this muscular projection is known as the papillary muscle. Okay, okay. Now we're going to move to the next slide, the next part of my presentation regarding the specialized and cardiac muscle fiber. Okay, what is the component of the specialized cardiac muscle fiber? It is composed of the sinoatrial node, SA node, which actually the pacemaker component of the heart, okay, the SA node. And where is location? The location of the SA node? It is located near the junction of the superior vena cava and the right atrium. Okay, maybe someone has tissue regarding the cross anatomy. So maybe someone has showing you where is the location of the SA node. Okay, it's located near the junction of the superior vena cava and the right atrium. And then the other component of the specialized cardiac muscle fiber is the internodal tract. And then we have the atrioventricular node, okay, AV node, AV bundle of his on the branches on the right and also the left branches, right branches and left branches. And then we have the Purkinje fiber, okay, Purkinje fiber that it also has a subendothelial branches. And then Purkinje fibers actually is equal to the subendothelial branches. Okay. Okay. The knots, every bundle and bundle branches are modified cardiac muscles. Okay. So this component, okay, of the specialized cardiac muscle actually is a modified form of the cardiac muscle, modified form of cardiac muscle fiber that are smaller than normal. Okay. The size of this cell is smaller compared to the cardiac muscles. Okay. Modified cardiac muscles fiber. Okay, Purkinje fiber, it lie in the subendocardial layer. Okay, subendocardial layer. Okay, lie in the subendocardial layer. The size. Okay, the Purkinje fiber, it lie in the subendocardial layer, and the size of the cell. Okay, for the Purkinje fibers, the size is larger than the normal cardiomyocyte. Okay. And the other features of the cell of the Purkinje fiber is the nuclei, where the shapes is round and larger in size, and it contains large amount of glycogen. Glycogen, there are a lot of glycogen that you can find in the cell, and this glycogen it appears as homogeneous pale standing region. Okay, so mean that this cell, okay, the cell of the Purkinje fiber is pale standing lah. Okay, pale standing region in the center of the cell surrounded by the myofibril. Okay, we show you. So you can see here. Okay, pale staining region in the center. So you can see here in the center here is pale staining, homogeneous. Okay, mm. In the center of the cell surrounded by myofibrils. So you can see here on the periphery part, it is surrounded by the. Okay, and this is the Purkinje cell. Okay, this is the Purkinje cell. So we try to enlarge the size of the picture, so you can see these are the Purkinje fiber whenever you see it on the large size. Okay, okay. So you can differentiate between the muscle, the cardiac muscles, and also the Purkinje fiber. Okay, based on these features. Okay, just now we have discussed on the histology of the heart. Now we're going to discuss on the histology of the arteries and also the vein. Okay, the general features of the arteries and the vein. Okay, the vessel itself, it has three layers: the tunica intima, tunica media, and tunica adventitia. So it has three layers. Okay, for the tunica intima, okay, it is the innermost layer. Okay, consists of the endothelium. Okay, endothelium is a single layer of squamous epithelial cell. It's a flattened type of cell. Okay, innermost layer. Okay, tunica intima. Okay, composed of endothelium. And then beneath the endothelium, we have the basal lamina. The basal lamina of the endothelium. It's like a foundation for the endothelium to sit on the basal. And then we have the subendothelial layer. Okay, below the basal lamina, we have the subendothelial layer, composed of the close connective tissue. And also, sometimes you can find the occasional smooth muscle cell. Okay. And then beneath the subendothelial layer, we have the internal elastic membrane. Okay, internal elastic membrane. Let me show you the internal elastic. Okay, this one. Okay, you can see here. Okay, this is the tunica. What just now? Tunica intima, right? Okay, so you can see here. Okay, tunica intima, right? Okay, the uh, the the inner layer. Okay, tunica intima. So you can see here. Okay, this is the very obvious. Okay, uh, the structure that I have mentioned just now, internal elastic membrane. Okay, you can see here. This is the internal elastic lamina or internal elastic membrane. It's very clear. Okay, but you only can see this brief picture and clear layer of the internal elastic lamina or membrane in the muscular artery. Okay. Okay. Internal elastic membrane is a sheet-like layer of fenestrated elastic material in the subendothelial layer in the arteries and also the artery. Okay, now we're going to move to the second layer, the middle layer. Okay, the tunica media. Okay. It is a circumferentially arranged layer of smooth muscles. Okay. And then it interposed with elastin, reticular fibers, and also the protoglycan. Okay, interposed with the other component. Elastin, we have other component that also present in the tunica media. Okay, we have the elastin, reticular fiber, and also the protoglycan. The lamina of elastin are fenestrated. Okay, some sort of like hole fenestrations. Okay, the lamina of elastin is fenestrated and are arranged in the circular concentric layer. Okay. Okay. The in arteries, it is relatively thick. Okay. In arteries, the tunica media, okay, the second layer or middle layer, it is relatively thick, and it extends from the internal elastic membrane to the external elastic membrane. So you see from this picture, you can see here, it extends from the internal elastic lamina or membrane or to the external elastic lamina. Okay. Okay, this is the tunica media. Okay. Okay, that is the features of the tunica media. And then how about the tunica adventitia? It is the outermost layer. Okay, and it is longitudinally arranged collagenous tissue and few elastic fiber. Yes, you can find only a few number of elastic fiber here. In the there are a few number of elastic fiber in the tunica adventitia. And tunica adventitia is relatively thin in most of the arterial system. Okay, in artery it is thin, but it's quite thick in venous and also the vein. So there is a way how you differentiate between the artery and vein, because the adventitia, it is thin in the artery system, but thick in the veins, and also in the venom. In large arteries and large vein, the tunica adventitia, it contains the vasa vasorum, large arteries and large vein. And we have the vessels inside the tunica adventitia. And not only vessel, we also have the nervi vascularis, network, the autonomic nerve that also present in the tunica adventitia. And then the vasa vasorum, it gives rise to the capillary network within the capillary network that presents inside the tunica adventitia. Okay, plus minus the tunica media. Okay, that is regarding the tunica adventitia. Okay, so you can see here, this is the blood vessels. Okay, this is the arteries, this is the vein. Okay, and for the large artery, this is the large artery, this is the large vein. This is the medium or muscular artery, this is the medium. Okay, and then this is the smaller one. Okay, we have the capillary. Okay, and then we have every small space. Okay, and then we also have the arterial. Okay, okay, and then this is the, you can see here, this is the capillary lah. Okay, the capillary. This is the arterial. Okay. Okay. So here we can see that there is a 3 layers, right? Tunica adventitia, tunica adventitia, and then we have the medial layer, okay, tunica media, and then tunica intima. Adventitia, media, and intima. Okay. And now we're going to discuss on the characteristic of the histological section of each different type of arteries. Okay. Okay, for the arteries, we have 3 types based on the basis of the size and characteristic of the tunica media. Okay, so it's mainly actually based on the characteristic of the tunica media lah. Okay, that is the way we name the give the name of the arteries. Okay, based on the characteristic of the tunica. So we have the large or elastic artery, elastic. Okay, large or elastic artery, more than 1 centimeter in size. Medium or muscular artery, 10 to 10 millimeter in size, and then small arteries and arteriole 0.1 to 2 millimeter and 10 to 100 micrometer respectively lah. For the small arteries is 0.1 to 2 millimeter. For arteriole is 10 to 100 micrometer. Okay, what is the characteristic of elastic artery? Okay, for the elastic artery, tunica intima is relatively thick. Okay, relatively thick, and it composed of the endothelium, and we have the subendothelial tissue, okay, beneath the endothelium, composed of collagen, elastic fiber, and smooth muscle cell. And for the internal elastic membrane, it's not conspicuous, it's not very obvious. Okay, you can see here, this is the tunica intima. So internal elastic membrane, okay, is not obvious, right? Okay. It is very hard to differentiate compared to the muscular artery that I showed you just now in the on the early part of my lecture. Okay, and the tunica media, yeah, definitely the tunica media is the thickest layer for elastic artery. Okay, it composed of multiple layers of smooth muscle cells separated by the elastic lamina. So you can see here the purple color. Okay, the purple color. The purple color actually is elastic lamella. Okay, and then we have the smooth muscle cell. Okay, in between there. Okay, you can see here the smooth muscle. Okay, smooth muscle you can see. Okay, the pinkish the pink color here is lamella. Okay, lamella elastic lamella. Okay, and then multiple layer of smooth muscle cell. In between we have a smooth muscle cell. Okay, so you can see the nucleus, right? Okay, the nucleus. The blue color, dark blue is the nucleus. Okay, and then we also have the collagen fibers and ground substance. The ground substance is actually consists of the protein. And then the tunica adventitia, this is the tunica adventitia. Thin, right? Okay, it's less than half the thickness of the tunica. Okay, thin. And then tunica adventitia composed of collagen and loose network of elastic fiber, and not in lamella. It's not in lamella. You can see here it's not in lamella compared to the tunica media, right? Okay, composed of the loose network of elastic fiber, but not in lamella. Fibroblasts, inside there we have in this layer we have the fibroblasts and macrophage, and there is a presence of vasa vasorum and nervi vascularis in the tunica adventitia. Okay, because the elastic arteries is large arteries, right? Okay, we have the blood vessels, autonomic nerve in the arteries. Example of the elastic arteries is the aorta, pulmonary artery, brachiocephalic artery, common carotid artery, subclavian artery, common iliac artery. Okay, and for the muscular artery, the tunica intima is relatively thinner. Okay, thinner than the elastic artery. Okay, the intima is thinner compared to this artery. And then it also has the endothelium layer. But somehow the subendothelial layer, subendothelial connective tissue is sparse. Okay. Okay. Here, the how we know that this this artery is belong to the muscular artery because of you can see there is a prominent internal elastic membrane. It's very obvious, very obvious. You can see the one line. Okay, you can see here that this is the internal elastic laminar membrane. Okay. Okay. So the tunica media composed of almost entirely of smooth muscle with little elastic material. So almost part of most part of the tunica media is actually composed of the smooth muscles and only small component of the elastic material. So you can see here the small amount. Okay, EF is elastic fiber, small amount of the elastic material. And then we have and then the third layer. Okay, the outermost layer is tunica adventitia. Okay, relatively thick. Okay, in external elastic membrane often present. Okay, you can see here this is the external elastic membrane. Okay, very obvious lah. Okay, and it separate the tunica media from the tunica adventitia. Inside in the tunica adventitia layer, it also has a fibroblast, collagen fiber, elastic fiber, and scattered adipose cell. And there are also present of nerve and small vessels that present in the tunica adventitia of the muscular. Okay. For the small arteries and arteriole, okay, differentiated from one to another by the number of smooth muscle cell layer in the tunica media. Okay. So in case of the small arteries, okay, it has the endothelial, connective tissue, smooth muscle, and have the internal elastic membrane. In the arteriole, it has an endothelium, connective tissue, smooth muscle, plus minus, okay, plus minus internal elastic membrane. Tunica media, so this is how we differentiate the whether it belong to the small arteries or the arteriole. Smooth muscles, 8 to 10 layers. Smooth muscle, 1 to 2 layers. So you can see here, most of the artery, the name is actually based on the character of the tunica media, right? And then tunica adventitia contain the connective tissue for the small artery, small elastic fiber, and thinner than the tunica media. And the arterioles, thin, ill-defined sheet of connective tissue. Okay, so these are the picture showing the small arteries. Okay, and we have the pictures of showing the arteriole. So you can see here the small artery. There's definitely the tunica media. The smooth muscle layer is small compared to the smooth muscle layer of the arteriole. Okay. Okay. How about the capillary? Okay, the capillary is the smallest diameter of blood vessels. The size is about 4 to 10 micrometer. Consists only a single layer of the endothelial cell. Okay, single layer of endothelial cell. Okay, it's common type of cell plus vessel lamina. Okay, just large enough to allow the passage of red blood cell. Okay, one at a time. Okay, very thin. Okay, because of the thin, the character the character of the capillary, which is very thin. So it allows the gases, metabolite, and waste product to move through their thin wall. Okay, so that is important of this characteristic. Okay, very thin wall. Okay, and the capillary arises from the arteriole or mid-arteriole. Okay, so these are the two uh, vessel that actually where is the capillary is actually arise from. Okay, whether it's arise from the arteriole or mid-arteriole. Okay, what is mid-arteriole? Okay, what is the mid-arteriole? Mid-arteriole, metatriol or metatriol is a thoroughfare channels that allow blood to pass directly from the arteriole to the vein. Okay, thoroughfare channel that allow blood pass directly from the arteriole to the vein. A larger diameter capillary with a discontinuous layer of smooth muscle cell. Okay, so large diameter capillary with a discontinuous layer of smooth muscle cell. Okay, that is the metatriol. Okay, and okay, I will show you where is the metatriol. I hope I have a picture. Okay, so you can see here. Okay, this is the metatriol. Okay, metatriol. Okay, metatriol is passing directly from the atrium to the venum. Okay, that is the metatriol. Capillary have a precapillary sphincter, which are located at the origin or at their origin. Okay, capillary have a precapillary sphincter at their origin from either from the whether it's originated from the arteriole or metatriol. What is the function of the precapillary sphincter? It controls the amount of blood flowing through the capillary network. Okay, you can see here, this is the capillary lah. You can see here, this is the endothelial layer. Okay, this is the red blood cell. Okay, okay. For the capillary, it has three types. We have the continuous capillary, we have the fenestrated capillary, we have the discontinuous capillary or sinusoid. Okay, for the continuous capillary can be found in the muscle, in the lung, and in the central nervous system. The adjacent endothelial cell have oxygen junction. It's very tight junction between the cell. Okay, we have a tight junction between the cell. And how we know it, there is a presence of the oxygen junction is it is indicated or marked by the cytoplasmic fold that protrude into the lumen. Okay, you can see here, this is the tight junction. Okay, cytoplasmic fold that protrude into the lumen, right? This is the continuous type of the capillary. Numerous pinocytic vesicles underlie both the luminal and basal plasma membrane surface. And this pinocytic vesicle actually function is to transport the material. Okay, you can see the small thing, small rounded structure that is inside there is actually a pinocytic vesicle. Continuous capillary may have a pericyte or rugged cell. Pericyte, you can see here, this is the pericyte, yellow, colored by yellow color. Pericyte is pericyte. Pericyte is a flattened cell that embracing the endothelial cell. It has a branching cytoplasmic process. Yeah, it's not shown here, but somehow it has a branch cytoplasmic process enclosed by the basal lamina that is continuous with the endothelium. Okay, it is covered by the basal lamina. Okay, you can see the blue color line. The blue, sorry, the gray color. Okay, the gray color is a basal lamina. Okay, enclosed by the basal lamina that continues with the of the endothelium. And this pericyte can give rise to the smooth muscle cell during the vessel growth. Okay, give rise to the smooth muscle cell during the vessel growth, during development or wound healing. Pericyte can be found in the capillaries and post capillary. Okay, so what is the function of the Cleyden junction? Is to control the permeability. Okay, I have shown you just now the continuous capillary. How about the fenestrated capillary? Fenestrated capillary can be found in the endocrine gland, site of the fluid in metabolite absorption, like for example in the gallbladder, and then also the intestinal tract. So what is the characteristic of the fenestrated capillary? It is characterized by the fenestration. Okay, there is a small hole fenestration. Okay, that presents on the cell. Okay, fenestration. Okay, also have pinocytic vesicle. Okay, the size of fenestration is about 80 to 100 micrometer in size. The function, okay, the fenestration it formed the channel across the capillary wall. Okay, the fenestrated capillary it formed a channel across the capillary fenestration. The fenestration may have a thin, non-membranous diaphragm across its opening. Sometimes it has a diaphragm. And diaphragm, characteristic of the diaphragm, it has central thickening. The The remnant of glycocalyc formerly enclosed in the penetrating vesicle from which the penetration may have formed. Okay. So whenever the absorption takes place in the intestine and gallbladder, the number of the fenestration, okay, the number of the hole, okay, and also not only the fenestration, penetrating vesicle also going to be increased, okay, and the wall of capillary become thin. Okay. So you can see here, this is the fenestrated capillary. So we have the intercellular cleft. Okay, you can see intercellular cleft fenestration now. Sorry, not this one. This one. Okay, this is the fenestration. Sorry. Okay, this is the fenestration. You can see here the fenestration. Okay, fenestration. Here, this is the fenestration. Okay. Okay, inside the cell also have a pinocytic vesicle. Okay. Okay, and then now going to proceed to discuss on the discontinuous capillary sinusoid. Sinusoid can be found in the liver, in the spleen, and also the bone marrow. Uh, it, it is larger in diameter and more irregular in shapes compared to the other capillary. So this is the special characteristic of the discontinuous capillary, larger in diameter and irregular in shapes. Structural features vary from organ to organ. They have specialized cell associated with the endothelial cell. Okay, they have specialized cell associated with the endothelial cell. Endothelial cell. For example, we have the stellate and sinusoidal macrophage or cell. Okay, so you can see here, this is the sinusoid. So there is a large intercellular gap. Okay, cleft. Okay, large intercellular gap. So this one is discontinuous capillary. In between the cell, there is a large gap. Okay, okay, you can see here. This is the sinusoid. Okay, you can see there are a lot of red blood cell. Okay, inside the capillary. So this is the endothelial. Okay, and then we have the arteriovenous anastomosis (AVA) or shunt. Okay, what is the arteriovenous anastomosis (AVA) or shunt? The arteriole that connect the arteriole that connect arteriole to the venule and bypassing the capillary. So that is the AV shunt, AV anastomosis. Arteriole that connect arteriole to the venule. Okay, can be found in the skin of the fingertips, nose, lips, and in the erectile tissue of the penis and also the clitoris. And the characteristic of its arteriole is coiled, okay, and it has relatively thick, smooth muscle layer enclosed in a connective tissue capsule, and the AV anastomosis or shunt, it is highly innervated. Okay. Okay. So for AVA, whenever the smooth muscle contract, okay, whenever the smooth muscle in the AVA contract, so the blood will flow to the capillary. But when the smooth muscle relax, the blood flow to the venules bypassing the capillary bed. So the function is for the skin thermoregulation, it is for the erection. Okay. 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 Just to show you the AV anastomosis. So you can see here, this is the arteriovenous anastomosis. Okay. For the microvascular bed, okay, normal sequence lah. We have the from the precapillary arteriole, capillary network to the postcapillary venule. There is the sequence lah. Okay, from the arteriole, okay, we have the capillary network to the venule, right? But in the middle here, we have the arteriole. This is the capillary lah. In the middle here, we have the Rocco channel. But here, we have the capillary. You can see here, capillary. Okay, there is the normal sequence. Okay, arteriole, capillary, and vein. And for the, and there is normal sequence. And then we have the AVA, arteriovenous anastomosis. Okay, this one, arteriovenous anastomosis. And then we have the arterial portal system. Okay, this is the arterial portal system. Okay, this one. Okay. For arterial portal system, for example, glomerulus in kidney. Okay, we have the afferent arteriole, glomerulus, and then we have the capillary, and then we have the efferent arteriole. Okay. glomerulus is capillary. Okay. This is the arterial portal system. Okay, arterial portal system. And then we have the venous portal system. The venous portal system, this is the arterial portal system now. Efferent arteriole, glomerulus, and efferent arteriole. Okay, so mean that there are two arteriole, efferent arteriole and efferent arteriole. For the venous portal system, adenohypophysis. Okay, adenohypophysis, capillary of the median eminence and infundibulum. Okay, hypophyseal portal veins, capillaries of the pars distalis. So this one. I hope I have example of the picture just to show you the. Okay, so just to show you the portal system now, whether it's arterial portal system or venous portal system. The arterial portal system, for example, glomerulus. Okay, because we have the efferent arteriole and efferent arteriole. Okay, but venous portal system. Okay, adenohypophysis, capillary of the median eminence, and capillary of the median eminence, infundibulum, hypophyseal portal veins, and capillary of the pars distalis. Okay, here, for example, in the portal system, so you can see here we have the two capillary bed. First capillary bed, second capillary bed, right? And then we have the in between we have the connecting vessels. Okay. So we have a different capillary bed. Okay, in case of the portal system. For example, okay, this is the hepatic portal system. Okay, this is the example. The arterial blood, right? Okay, the arterial blood, then that actually someone that absorb the nutrient, okay, from the stomach and also the intestine, right? Okay, nutrient and toxin items being absorbed from the first capillary bed. Okay, and then go to the liver, right? Okay, and then go to the liver from where? Okay, through the hepatic portal vein, right? Okay, hepatic portal vein. Okay, and then in the liver we have the second capillary bed, the liver sinusoid. Okay, nutrient and toxin will leave. Okay, go into the liver cell, hepatocyte, and then blood will go into the hepatic vein. Okay, and then later on we go to the venous blood. So this is the flow. This is the basic scheme of the hepatic portal system. Okay, portal system usually they have what you call that two capillary bed. Okay, first capillary bed and second capillary bed. Okay, for example, here we have the hepatic portal system. Okay, here we have the first capillary bed and second capillary bed. Okay. And then, okay, this is just to show you the microcirculation. Okay, so whenever the sphincter is open, okay, this is the precapillary sphincter. Whenever the sphincter is open, so you can see here the blood will flow to the capillary, right? Okay, blood will flow through the capillary. Whenever the sphincter is closed, the blood will flow, okay, through the medarteriole. Okay, in the middle thing is a medarteriole, okay, okay, open and close. Okay, so I have you explain this part, right? The portal system, okay, to capillary bed, okay. Okay, now we're going to move to the vein. Okay, for the vein, compared with the arteries, the tunicas of the large and medium vein are not well defined. Okay, the tunica layer, okay, the layer of the large and medium vein are not well defined compared to the arteries. And the internal elastic membrane is absent. So this is the characteristic of the vein. Okay, and the other characteristic of the vein have thinner wall than compared to the arteries. Okay, accompanying artery, the similar size of the artery. Okay, usually the vein is thinner. And the vein usually is large lumen compared to the artery. The lumen is usually collapsed. Okay, collapsed lumen, larger in size of lumen. Okay, the thinner wall. Okay, because this is the characteristic of the vein you need to remember. the vein contain valve. Okay, the vein contain valve, especially vein that convey the blood against gravity. For example, vein that present in the limbs. Okay, lower limb. Okay, the vein. There are three types of vein that we know. We have the small vein or venule. Okay, small post capillary venule is the size about 10 to 50 micrometer in size. Muscular venule is about 50 to 100 micrometer in size. For the medium vein, is 1 to 10 millimeter in size. For the large vein, is more than 10 millimeter in size. So we have the three types of vein that you have to remember. And then for the post capillary venule, it is composed of the endothelial cell plus basal lamina. So basal lamina is located beneath the endothelial cell. And there is also presence of the pericytes in the post-capillary venule. Post-capillary venule is actually the main site of action of the vasoactive substance, for example, histamine and also the serotonin. Okay, you can see here, this is the post-capillary venule. Okay, post-capillary venule. And for the muscular venule, okay, the tunica intima, it is composed of the endothelial cell. Beneath the endothelial cell, we have the basal lamina, and in the tunica intima, it does not have elastic fiber for the muscular venule. Okay, for tunica media, there are one to two layers of smooth muscle, very thin now, thinner. If we want to differentiate from the post-capillary venule, because in the post-capillary venule, how we differentiate? Okay, because here tunica media, we have 1 to 2 layers of smooth muscle. Okay, but here it seems that post-capillary venule, it does not have a smooth muscle. Okay, and thin tunica adventitia. Okay, thin tunica adventitia. That is the characteristic of the muscular venule. Okay. Okay. PCV just now is a post-capillary venule. Muscular venule, here you can see here. This is the muscular venule. Okay. Okay, muscular venule. And then for the medium vein, okay, most vein that have the names, valve is most numerous in the lower limb. Okay, because of the against gravity now. That's why there are large number of the valve present in the medium vein in the lower limb. And for the wall, the tunica intima, it composed of the endothelium with the basal lamina, and there is also present of thin subendothelial layer, okay, composed of connective tissue with the equinox and smooth muscle cell. In the tunica media, there are several layers of circularly arranged smooth muscle cells. Okay, you can see here, circularly arranged smooth muscle cell in the tunica media. Okay, and then collagen fiber, elastic fiber, and also the longitudinal smooth muscle cell that may be present immediately beneath the tunica adventitia. Okay, there is the medium vein now. This is tunica media. Okay, and then tunica adventitia. This is the characteristic of the tunica adventitia on the medium vein. Thicker. You can see here, thicker compared to the tunica media, right? Okay. That is how you differentiate whether this is vein or arteries. Okay. Okay. Tunica adventitia is thicker than tunica media, composed of collagen fiber and elastic. And for the large vein, the wall, the tunica intima, composed of the endothelial cell plus basal lamina, subendothelial layer, composed of connective tissue and some smooth muscles. Tunica media, boundary between the tunica intima and media is not distinct. Okay, it's not obvious lah. Okay, boundary between the intima and also the media. And then tunica media is relatively thin. Okay, you can see the boundary, right? It's not very easy to differentiate the boundary between the intima and also the media. Okay, and the tunica media is relatively thin. Okay, there is a circularly arranged smooth muscle cells composed, and this layer also composed of collagen fiber and the fibroblasts. Okay, so you can see here, most probably this is the tunica. tunica media of the large vein. But somehow it's very, there is no clear boundary that separate between the tunica media and also tunica intima. Okay. And then tunica adventitia definitely is the thickest layer lah. You can see here, tunica adventitia. Longitudinal smooth muscles, bundles also present. There is a collagen fiber, elastic fiber, fibroblast, and there is a present of the vasa vasorum. Okay, that present in the tunica adventitia. Okay, for example, vena cava, subclavian vein. There is the large vein. Okay, okay. For the venous valve, okay, venous valve, the valve that present in the vein, it is a semilunar projection of the tunica intima. Okay, projection of the tunica intima. It lined by the endothelial cell on the both surfaces. Okay, the core of the venous valve, the core of the venous valve. So you can see here, this is the venous valve. The core of the venous valve, okay, it composed of thin fibroelastic connective tissue, and it has two leaflets. You can see here, number 1 and number 2. It present in the vein of more than 2 millimeter in diameter. Okay, with the venous valve. Okay, that's all. Thank you. I hope you enjoy this presentation. Okay, and most of the information from this lecture is very important. Okay, so I hope you can remember whatever information or the facts that I have delivered through this lecture. Thank you.